Hi guys, welcome to this week's lesson. This is week 3. So far, so good. I did make myself bigger because I'm going to use my face and my neck to go over a lot of these landmarks. I'm going to be pointing to the images as well on the screen, but it's just so much easier for me to point to the structures on my own face. So let's get started. So we're going to start with the bony landmarks of your skull. So the anterior skull. If you're looking at the skull from the front, which is the anterior side of your face, we're going to start with the frontal bone. Frontal bone is literally everything that encompasses your forehead. It is connected to the maxillary bone, which is right here where your top teeth sit. And it also forms the medial side of your orbit. So the medial side is the center part of your eyes, your orbits, which is right here. In this image, the entire number 1 is the frontal bone. The superciliary arch is actually the arch of where your eyebrows are. So that is where the superciliary arch lies. It's kind of like this mound right next to the orbit, which is the opening where your eyeball is. Number 3 is your glabella. Glabella is right here in the middle. It's where the frown lines are. So whenever you see people getting Botox and they go in for their frown lines, they're getting Botox injected into the glabella. That right there, that's the glabella region. So think of it like that, Botox. The nasion. The nasion is literally where your nose meets your forehead. It's exactly at that point where that ridge, your nose ridge becomes come out of your face. So most obviously seen on a profile view or on a lateral view. The superior orbital margin, so number 5 in this case, it's literally that ridge right around where your eyeball is. So it's not where your eyebrow is, it's below your eyebrow, right where you can feel like the opening into the space of the orbit. Your maxilla is this part right here. The bone that sits right here where your top teeth are all connected to your maxilla. It encompasses your nose. Your nose is inside of your maxillar bone. The zygomatic bone is your cheekbone. So those ridges that you see, that's actually called the zygomatic arch. You'll obviously have one on each side of your face. It creates the prominence of the cheek. It has an articulation with the frontal process of the zygomatic. So what I wanted to talk about with the zygomatic bone is there's something called the mid-zygoma point, and this point is between the external acoustic meatus, which is the inside of your ear, and the lateral canthus, which is the side of your eye. So the point between these two, the midway, is called the mid-zygoma point, and it's part of that ridge of where the zygomatic arch is. The angle of the mandible. So everybody has a mandible. That's your jaw. In this case, it's number 8. The angle, which in some people is more prominent than others, is a very important structure. It's very easy to see, very easy to localize. The sphenoid bone. So the sphenoid bone, it looks like a butterfly. It's inside. It's hard to see on this image because it's one of the bones that's inside of your skull. In this case, it's number 9. So here you just have a tiny little part of what the sphenoid bone is, and it sits really behind your eyes. The temporal bone, you guys know that that's next to your temporal lobe, which is where your ears are. In this case, down here, right behind where your ear is. And then number 11 in this image is the parietal bone, which is the sides of your head, or the parietal bone. Going over the structures as they are mentioned on the book, let's see. The one thing we didn't mention on this view, because it's the anterior view, is the mastoid process. So let's go look at the lateral view. That's going to help us hit the mastoid process. So bony landmarks of your lateral skull. We're going to obviously go over some of the ones that we already mentioned, but the frontal bone is your forehead. It's right where your forehead sits. The superciliary arch, we just went over it, where your eyebrow is. The glabella, where people get Botox. Think about it that way. The nasion, right below the glabella, where your nose meets your forehead. Superior orbital margin, the SOM, where the eye socket, the superior part of the eye socket is. Maxilla, where your top teeth lie. So all of this, and it meets with your orbital, with your orbits, all right? It meets with your frontal bone and your orbits. So you know it's going to encompass, it's going to go down like this, kind of like a triangle, and then it's going to encompass all of the sockets for your top teeth. The zygomatic bone, your cheekbone. The lateral canthus. So the canthus of the eyes are where your top eyelid meets your lower eyelid. You have a medial one. Medial means towards the center. So the medial ones are here. The lateral ones are on the sides. Your lateral canthus, in this case, it's where your top eyelid meets the bottom eyelid on the side. In the picture, it is right here. Your mid-zygoma point, like we said, from the midway point from the lateral canthus all the way to the external acoustic meatus, which is that little canal, the ear canal, essentially, that space that goes into the ear, is your mid-zygoma point, which is number 9 in this image. The mastoid process. So this is a part of your skull. It's a little bone that you can actually feel it if you touch behind your ear. You can feel your mastoid process. It's a prominence. It comes out. And it is used, you know, it's very easy to feel, and you can actually use that to make sure that the patient is, you can feel on both sides of the patient's head. If you're trying to create a mask, you want to make sure they're nice and straight. That's a good point to start with. The angle of mandible, like we mentioned in the previous image, where your jaw has the angle of your jaw. Your external occipital protuberance, or the anion. So that's actually number 13. That's in the back. So occipital bone. Occipital bone is the one in the back where your occipital lobe is, and the external occipital protuberance. Protuberance means like something that's jutting out or coming out. So it's like a little notch on the back of your head. The greater wing of the sphenoid bone. Again, the sphenoid bone is really hard to see because it's actually one of the bones inside of your skull. In this image, it's number 14. It's literally just this tiny little square, or rectangle here. Your temporal bone. Temporal bone sits right behind your ear where your temporal lobe is. Parietal bone, where your parietal lobe is, right here on the side of your head. The parietal eminence, it's kind of like this ridge on your parietal bone. I mean, I couldn't really feel mine, but I guess you kind of can. You kind of can. It's just like a ridge. The sternocleidomastoid muscle. I love saying that. I learned that in anatomy back in college. The sternocleidomastoid, it attaches from your occipital bone in your skull all the way down to your clavicle, and it is a muscle that helps your neck move and turn. Sternocleidomastoid. Such a fun name. Your trapezius muscle. It's another one, but instead of coming from the occipital to your clavicle, it goes from the occipital, or sorry, instead of coming up to the front of the clavicle, it actually goes from the back of the occipital to the back of your clavicle, which is, or the most posterior part of your clavicle, which is actually your traps. I know you guys I know you guys have been to the gym. I know you guys have seen those big, heavy bodybuilders with big muscles right here on their necks. They're trapezoids. That's what they're talking about with the trapezius muscle, the traps right here. And finally, your clavicle. Your clavicle, you know, you can feel it. It comes out right here, right below your neck. This is actually the most inferior border of your neck, is your clavicle. Let's see. And then with reference to the things that the book mentions. So the angle of mandible, in this case number 12, it's actually a good reference point to know where the tonsils are, the lingual tonsils, the one inside your mouth. And it is also where several lymph node groups are located. And we're going to touch base on those lymph node groups at the end of this. It's going to be for this week. It's going to be at the end of this video, or maybe I might make another video separate to that because there's a lot of information on lymph nodes. All right, moving on. Let's talk about landmarks that are around the eyes and the nose. So let's start with the eye. So let's cover the nose for right now. If you're looking at the eye, the superior orbital margin. So orbital, we're talking about the orbits, which is the eye socket. There's an orbital margin, which is literally the borders of the orbits. And there's a superior orbital margin on the superior portion. There's a lateral, there's an inferior, and there's a medial. Very simple. If you know your directional terminology, it's very simple to remember which one's superior, inferior, lateral, and medial. There is the inner canthus, which we just visited that term. It's literally where the medial side of the two where the eyelids meet medially is called your inner canthus. Where the eyelids meet laterally is your outer canthus. And your punctum lacrimae. It's literally, if you go to the bathroom right now and you pull down on your lower lid and you look at your inner canthus, you're going to see a dot there. That is the punctum lacrimae. It is where the lacrimal sac collects tear ducts. So where it's the duct that collects tears, or lágrimas if you speak Spanish. It's called tears in Spanish. It's where the tears go into this little lacrimal sac, and it kind of helps dry up those tears from your eyes. Your eyes are always constantly wet. So when you cry, there's an excessive amount of water, and that's why the tears run down your cheeks. But your eyes are always staying hydrated. And the reason why we're not crying all the time is because we have that lacrimal sac. And when you're treating a patient to their head, you want to make sure that that lacrimal sac is protected. Or it's avoided, I should say, because if you treat that with radiation, there's a very high likelihood that the patient's going to have watery running eyes forever, because their duct is going to be clogged. It's going to have scar tissue, and it's just not going to be able to absorb those tears like it normally would. So if you're doing an electron, if you're treating a whole brain, that's a structure to look out for. You don't want to hit it. Another thing is the lens of the eye have a very low tolerance, so you always want to make sure that the lens are out of the field if they're not supposed to be there. All right, landmarks around the nose. So here's our nose, the soft tissue landmarks. So the structures or the landmarks around the eyes and the nose are very, they're soft tissue. They change. Your eyes are constantly opening and closing all day. Your nose, your nostrils are opening and closing all day as you breathe, when you sneeze, your mouth. These are not very reliable when it comes to being precise or position and accuracy, but they do give you a good reference point. So it's important that you know these structures, that you know where these landmarks are, but you also need to know and be aware that it's not going to be the most trustworthy point when you're talking about precision for radiation therapy field. Or setting up a patient. You need to find more stable landmarks, like bony landmarks. Those are most likely to remain in the same spot. So here we go. The glabella, again, Botox. The nasion, where the nose meets the forehead. The Alanasi or Nasi, I'm not sure if it's Alanasi or Alanasi. Those are the sides of your nose, basically where they're made out of cartilage. So, if you ever look at a skull, these are kind of gone. You just have a hole where the nose is. It's because cartilage can, decompose and not be there, whereas bone tends to be there longer. So those are your Alanasi, these little, and then there's obviously the lateral Alanasi, and then the external nares is the hole, literally your nostril. So the lateral Alanasi, the inferior Alanasi, and your Alanasi is this entire thing. Right, that was the nose. The nose is very simple. Let's move on to the mouth and the ear. So starting with the mouth. The commissure of the mouth is formed at the junction of the upper and the lower lip. This landmark it's extremely mobile because we're talking all day. So the commissure of the mouth, here it is. You have the right side and you have the left side, where your top lip and your bottom lip meet. The mucocutaneous junction is located at the junction of the vermilion border of the lip with the skin of the face. So the vermilion, what is it called? Vermilion border. That is literally if you look really close in the mirror and you see where your face skin and your lip kind of come together, that's known as the vermilion border. It's also known as your mucocutaneous junction. And that's why your lips and your skin have different, look different. They're not made of the same type of skin just going all the way through. They're not the same types of cells, I should say, going all the way through. And then finally, your vermilion, so this is the vermilion surface, is your actual lip. The vermilion border is just the edge of it, which is also known as your mucocutaneous junction. The philtrum is the little ridge right here, right above your top lip. It goes all the way up to your nose, and where the philtrum connects to your nose is known as your columella. And finally, the ear. The auricle or the pinna is another name for the ear. You're going to hear auricle or you're going to hear pinna. Either one is correct. And then the tragus is the name of the hole. Guys, just say it as simply as I can. It's the hole that goes into your ear canal, essentially. So again, if you know your directional terms, the tragus is going to be divided into the superior portion, the anterior portion, the inferior portion, and then this little ridge right here, right above your earlobe, is actually known as the antitragus because it kind of goes in the opposite. It like goes into the tragus, so it's known as the antitragus. And this is known as the helix of your ear. Pretty straightforward. The one thing I do want to say about the ear and your tragus, the tragal notch. So in this case, these notches that are around your ear canal, you use those when you're in CT Sim and you're going to create a mask for like a whole brain. You want to put your laser, so your lateral laser, you put it on the tragus on one side, and you want to see if it's landing on the tragus on the other side, the opposite laser. And if it isn't, then that means that the patient's head is rotated. So once you have a patient lying flat on the head piece and you have a lateral laser going here, a lateral laser going here on each one of the tragal notches for each ear, you know that that patient's head is straight. So you do use this term a lot in radiation therapy. And another way that you make sure, that is if you want to make sure that the head is not in this direction, that the head is not rotated. In order to make sure that your head is not rolled, your head is not rolled, sorry. And then to make sure that the head is not rotated, you put a laser on the patient's canthus, and you want to make sure that the lateral canthus on both eyes are lining up to that laser. If it's like this and your laser is going like this, then you know that the patient's head is actually tilted in a direction that's not good for you. It's not going to be a good mask. So canthus you use a lot, tragus you use a lot, vermilion border you use a lot. These are all terms that might be new or they might not be new to you, but you're going to see them a lot more in radiation therapy. All right, landmarks and anatomy around the neck. The neck, to me personally, is the most difficult part of the entire head because there's just so much going on and it's so small. It's hard for me to visualize. So it takes me quite a bit. It takes me quite a bit to get through the neck. But I'm going to go through this with you guys. So let's go over this image and look at the landmarks that we're talking about in terms of bony landmarks. So the mandible, we've been through this. The mandible is this big old bone right here. The angle of the mandible is number 2, where your jaw, the jaw angle is. Your hyoid bone, it's a bone in here in your neck, and you can actually move it around. You can actually move it around. Your thyroid cartilage. The thyroid cartilage is it's what forms the Adam's apple on men. It tends to protrude out a bit. That tends to be the thyroid cartilage. And right below the thyroid cartilage is where the thyroid gland is, and that's where the name comes from. Your cricoid cartilage, it's right beneath the thyroid cartilage, and it is the only structure in your, or the only piece of cartilage in your neck that actually encircles the entire respiratory passage. Your thyroid cartilage is actually open posteriorly, and so are all those other structures. The only one that's actually encircling the entire airway is your cricoid. The mastoid process, we touched base on this again. This is the one right behind the ear, part of your skull. Your external occipital protuberance, the one in the occipital bone back here, also part of your skull. The atlas is one of your vertebral bodies. It's actually the first vertebral body. It's also known as the atlas. And the axis is the second vertebral body, C2. The suprasternal notch. It's this little hole right here. It sits between the two clavicles, right on your neck. Very important in radiation therapy. You're going to use that all the time to make sure that your patient is nice and straight. You're going to sink your finger in there. You're going to be right between the two clavicles, and that's how you're going to know if your patient is straight on your table. Your clavicle, you know that. The sternocleidomastoid muscle, very fun to say, from the lateral part of your occipital bone to the anterior portion of your clavicle. Helps you turn your neck. Your trapezius muscle, your traps. All right, from the posterior part of your occipital bone to the posterior part of your clavicle. Or lateral part of your clavicle, I guess I could say. Let's see. And then on this table, this is associated anatomy to different levels of your C-spine. So around C1, which if you look at this image, C1 is so close to your ear. The transverse process lies just inferior to the mastoid process. So if you can feel your mastoid, you know that that's probably at the level of C1 right there. So C1 is almost like at the level of your nose, if you want to think of it that way. C2 and C3, it's level with the angle of the mandible. So the angle of the mandible is a few centimeters below the mastoid, so that makes sense that it's C2 and C3, probably at the level of your mouth, if you want to think of it that way. It lies 5 to 7 centimeters below the external occipital protuberance, so the one down here. So 5 to 7 centimeters below that. At C4, we have a couple of landmarks. We have located just superior to the hyoid bone of the neck. So the hyoid bone is, you can actually move it side to side in your throat. So you know that it's located just superior to that is C4. And that makes sense because the angle of the mandible is right above it, which is where C3 is. So going down, so this is where C4 is. It's also in level with the superior portion of the thyroid cartilage. That makes sense because the hyoid and the thyroid cartilage are almost right next to each other. You can see it better on this image right here, 3 and 4. C6, in level with the cricoid cartilage. So now you know we're going down the neck at this point. C6, in level with the cricoid, the only one that encircles your entire respiratory passageway. And then C7, it's the first prominent spinous process in the posterior neck. So if you actually bend down, you look down at the floor and you feel the back of your neck here, you're actually going to feel something, the spinous process of C7 sticking out. It's an obvious landmark, and we do use that because you know that that's where the C-spine ends and where the T-spine starts. Very important when you're treating the high up area of the T-spine. You tend to be kind of in a difficult spot about how to position a patient. If we're treating T1, you know, do we really want to put the arms up and put them in a back lock? Does that seem like the best idea, or could we get away with actually using a mask? Because T1, if C7 is right back here, right almost at the level of the suprasternal notch, that means that T1 is laying right there. This part of your body is going to be very well encompassed by a mask that goes down to here. And there, you're going to have a lot more control over that area than if you were to, you know, let's put the arms up or let's put them in a back lock or something like that. Masks actually work great for the superior portion of your T-spine. T1 to T5, those are all great areas to target and immobilize using a mask, a long mask. All right. Now we're going to talk about the pharynx. All right. The pharynx. It connects the nasal and the oral cavities with the larynx and the esophagus. So it is divided into the nasopharynx, the oropharynx, and the laryngopharynx. Let's see. Let's start with the nasopharynx. Naso from like nose, pharynx. So this is again the membranous area that we're talking about. So the nasopharynx lies in the nasal cavity where your nose is. This is your pharyngeal tonsil. We talked about those, the adenoids. Then it connects down to your oropharynx. Oro referring to the mouth. And this is where your palatine tonsil is, right back here. And it's at the level of the mouth. Yes, that's the most important part of the nasopharynx, the oropharynx, and then it moves down to the laryngopharynx. Laryngo because it's talking about the larynx. So the laryngopharynx is where you have the separation between what's going to go down to the airways and what's going to go down the digestive system. So what's going to go down the trachea and what is going to go down the esophagus. And the beginning of the larynx is actually at the epiglottis. Which is the structure here. The epiglottis shuts, it closes when it doesn't want something to go, you know, down the wrong pipe in that sense. It's what helps prevent food from going into your trachea and into your lungs, and it keeps it going down the esophagus. And the most important thing that I want you guys to remember from this image is the order of the structures from anterior to posterior in terms of the trachea, the esophagus, and your spine. The trachea is anterior to the esophagus is anterior to the spine, always. And the book has a little trick to remembering this. The order is always set up. So if you're looking at it from the posterior side, you think of the word set up, and it's S for spinal, for the spinal cord, E for esophagus, and T for trachea. So set, spinal cord, esophagus, trachea. Alrighty. Moving away from the pharynx. That's not my favorite part if you can't tell. Now we're moving on to the larynx. The larynx. So the larynx, again, this is the beginning. What connects the mouth and the airway that separates from the esophagus, what's going to get eaten, and what with the air that we breathe. It's where your vocal cords are as well, and it's what ends up connecting to your trachea. So the larynx begins at the epiglottis and goes all the way down to the cricoid cartilage, which is right here. After the cricoid cartilage, we start calling that tube, or that lumen, we start calling it the trachea. It has the three regions: the supraglottis, the glottis, and the subglottis. And this is referring to using the glottis, or the vocal cords are known as the glottis. So supra, above it, everything that's above it, and subglottis, everything that is below the level of the vocal cords. So again, it serves as a passageway for air moving in and out of the trachea and functions to prevent foreign objects from entering the trachea. That is the epiglottis. And then the cricoid cartilage serves as the lower border of your larynx, and it is the only complete ring of cartilage in the respiratory passageway. All right, and then here's just a different view if you're looking at it from the antepost. So this is sup, this is inf, this is right, this is left. Here's your epiglottis. Here is your cricoid thyroid. This is the cricoid muscle, but this is the one that I want to talk about, the cricoid cartilage, and this blue one up here, the big one, is your thyroid cartilage, which is the one that projects out on males where their Adam's apple is. And we've reached the area, or the point, of lymphatic drainage. There is so much that I want to go over with lymphatic drainage. It seems like a lot of information. It might seem a little overwhelming, but again, as long as you know your anatomy within the neck, all the names of all these nodal groups are gonna be tied to that anatomy. So we're gonna review the anatomy. We're gonna go over the names of each one of them, and we're gonna break them down. I'm gonna do it in a different video because I don't want this to be super long. So I will see you guys again next time to finish out this part of the lecture for this week. Thank you guys so much, and I will see you guys in the live session.